When people look in the mirror, they say, God, what really bothers me are these 11s. So most of the time, we're gonna just treat that area with Botox. If you have a lot of deep lines between your brows and your forehead, that's just gonna be using a neurotoxin. If you're saying, you know, my eyes are really hollow underneath, I don't like the way that looks, then we may recommend Bellatero, which is a tear trough filler that generally will last you 12 to 24 months. You're probably gonna need a couple syringes. It can cost you anywhere between $900 all the way up to about $2,700, depending on how hollow that area is. But it does last a couple years. The other area that people are really concerned about is their crow's feet. That's gonna be usually doing a neurotoxin, Botox, or Dysport. You know, that area is gonna usually cost you between, $200 to $300 per treatment every 3 months. And then sometimes if your tear troughs are really bad and you've also lost the structure of your cheek, we may recommend you doing a little bit of filler in that cheek to kind of lift it, to give us a foundation, and then do cheek filler, because sometimes if we do a combination, you might not need as much filler in your cheeks if you build that foundation in your cheek, and it's gonna give you a much more youthful look than having tear trough filler there and then you're flat here. But it's gonna be all up to what your goals are with your injector. Another area that women like to complain about that I hear is their lips. We struggle with our lips because as we age, we're losing collagen, elastin, our bones actually shrink, our muscles shift and they drop because the elasticity of our skin can no longer hold it in place. So think of, for example, you have a water balloon and you have that water balloon and you fill it up. But if you leave it out in the sun and in the elements for a period of time, it's going to shrink up. That's kind of what happens with our face as well. The skin starts to shrink, the muscles will shrink over time, the bones will shrink. And so that's where we go in and we're gonna use fillers to refill that volume. We are going to use skincare topical products to fix the skin integrity, to make it more tightness, firmness, texture, tone, and clarity of the skin. So how we accomplish getting the skin to the goal is using topical products along with maybe some laser, maybe possibly microneedling. Hydrofacials is very popular here because that exfoliates, extracts, and infuses peptides into the skin. So that helps with the hydration. So it's really gonna be what your goals are as a patient and what your expectations and what you're wanting to accomplish of what your treatment plan is going to be.